Hello, and welcome to HIPAA Audits. Now, before we get into today's presentation, let's first acknowledge the elephant in the room. You may never be audited by the U.S. Department of Health and Human Services Office for Civil Rights. That is the elephant in the room. Now, does that mean you should not consider the benefits of integrating a culture of compliance? As we review the details today of what OCR requires of a HIPAA audit, you may consider the value audit planning has on improving the overall efficiency, culture, and safety of the practice. Now, often we hear, well, it's just not reasonable to be completely compliant. And we would agree that compliance is an ongoing process. Now, consider this example. Meet Amy. She recently joined a private practice as an office manager to grow her administrative resume. But what she didn't plan on having to adjust for was a major blind spot at the practice. They were behind with many of the policies and procedures required for OSHA and HIPAA. Now, of course, she came into the practice just ready to take on it all. She was confident that she could do her other tasks and also update the compliance program. And so Amy, almost immediately after hearing about the holes in the compliance program, she opened up her Outlook calendar and then scheduled a date when she would have all the policies and procedures updated and have completed compliance training with the staff. Now, as you can imagine, and perhaps even relate to, months went by and no efforts whatsoever had been made with the compliance program. In fact, the reminder alarm from the Outlook calendar had been dismissed many, many times. And for over a year, Amy had battled with having to research what is required to develop an adequate compliance program. And she ended up getting to a point where in her mind, the only resolution was to hire an outside consultant if needed or accept a fine if audited. Kind of a sad state to be in and an expensive and very costly decision. Well, at HCSI, we agree compliance can feel like drinking from a fire hose, okay? We know you wear a few hats of responsibility, and it's no wonder that many have procrastinated on updating their compliance program. So hopefully this presentation can help you understand what you can expect. You should be audited on in the next few months, and perhaps increase your desire to improve upon your culture of compliance. Now, who am I? My name is Lance King. I'm the Vice President of Sales at Healthcare Compliance Solutions. And many of you have been personally invited by me or been invited by somebody from your company or perhaps a friend who thought this presentation could assist you in your efforts as a compliance officer. Now I'm going to be presenting today. I will be answering some questions following the presentation. Here's my contact information, lking@hcsiinc.com. And you're welcome also to email support@hcsiinc.com, where we have compliance specialists with OSHA and HIPAA as their specialty. They can answer some questions. A little bit more about me. I'm from Salt Lake City, Utah, and I'm very passionate about family time. And that's really all I'll say about that. I love the outdoors. I'm a racquetball player. I love to exercise, but aside from the things I enjoy personally, I just love spending time with my family, with the games and vacationing and everything else. And this is definitely a great time to be thinking about vacationing with warmer weather in many different states. It's an exciting time, and it's an exciting time to be living. Well, the more I'll say, the more I've learned about many of your lives is in the healthcare profession is practice administration. Quite frankly, the more I learn about the lack of time many of you have out of the office, and it's because I realize you wear many, many hats. I'm with HCSI because it's a very rewarding position I am in to help people do more with less. Help people automate things like compliance, and I enjoy knowing that our customers have peace of mind. Those of you that are watching for the first time, and of course customers are watching, hopefully we can help you to that end, to have peace of mind and time for peace as a result of a potential partnership, or of course if you're a customer, the partnership that you have. Now, who is HCSI? Well, in short, we're a compliance partner of healthcare providers and of business associates. And I take great pleasure in saying our mission is to incorporate a culture of compliance. We believe it has to be a culture with OSHA, HIPAA, Medicare, and employment law. And we believe that the best way to do this is with when the compliance officer is given the support and the resources needed for autonomy and for engagement to be achieved throughout the organization. Now, I'm going to talk about what to expect. And physicians and office administration of healthcare practices and business associate companies, please note, just before I introduce the presentation details, that phase 2 audits for OCR begins in a couple months. In fact, there is going to be in April a new protocol within the HIPAA audits that they'll be putting out to the public for review. Many of you may have known March 1st, 2016, Devin McGraw of HHS Office for Civil Rights mentioned that they are in the process of verifying addresses of the certified entities and business associates that they'll be visiting. So just something to consider. And here's what you can expect in this webinar to help with audit planning. We're going to go through the penalties for HIPAA violations, give you an example, and then a brief introduction to HIPAA audits. And then we'll role play where I'm an auditor and I'm just going to walk through the major requirements of what they're going to be looking for. Specifically within the risk management program, business associate contracts, notification individuals. We'll go through some additional areas for audit which you may have questions for, and then some conclusions. So first with penalties. The penalties for violating HIPAA rules, they really will vary. For example, if the office is found to be in a state of noncompliance with HIPAA regulations, but the administrator and compliance officer made an attempt, but simply did not know what to do exactly, the fees then can range from $100 to $50,000 per violation. However, if the office is found to be in a state of noncompliance with the HIPAA regulations and the attitude of the administrator and compliance officer is, I don't care, or I will never get audited, why should I be doing this? If that's the attitude, then the fines can be just a big, $50,000 per violation. And these fines will add up very quickly based on the number of violations. It is quite common to see fines and settlements total over $1 million. So this is something that, and this is just HIPAA, but it could be very problematic. Here's an example with Everett Clinic. Example of failing to be compliant with HIPAA rules and the lasting impact that it can have on a company. And I will just say HIPAA violations can hurt your company, and not just financially. Remember, you have employees. It can cost them their jobs and have a very negative effect on the reputation of your company within the community and within the industry, and certainly your own individual reputation. So Everett Clinic in Everett, Washington, they use fair warning software. And what that does is it red flags unauthorized access to EPHI. Okay, so they have that as something as a safeguard. Now, they took a lot of security in that. In fact, not only after they used fair warning, 13 staff members and physicians were fired due to various incidents that involved inappropriate access. Their CIO, Becky Hood, has been quoted to say, "Our policy leans toward no tolerance of record snooping, but we'll investigate each situation to determine if the incident was malicious, accidental, or if a staff member didn't understand the rules." Now, I bring up this example simply to say that Everett Clinic thought that they had a safeguard that would be enough. But as you'll learn through this presentation, there is much more required than just an EHR system, which many take security in, and software. It requires people to really integrate a culture of compliance. The Office for Civil Rights, and I'll just from here on out just say OCR, HIPAA audit program. It's going to analyze. So it functions to analyze processes, controls, and policies of selected covered entities to the HITECH Act audit mandate. And OCR has established a comprehensive audit protocol that contains the requirements to be assessed through these performance audits. And again, a new protocol is going to be coming out in April. And the entire audit protocol, it's organized around modules, representing separate elements of privacy, security, and breach notification. And we'll be covering that. And the combination of these multiple requirements can really vary depending on the type of covered entity selected for the review. So just a few things to keep in mind. Now, what areas are covered? Well, before I get into that, let's just say a member of your office staff has accidentally mailed out the appointment list for the day, containing patient names, date of birth, social security numbers, and phone numbers to another patient, along with their new patient packet. Just a few questions. What should you do? Does your staff know who to report this incident to? Is there a HIPAA compliance officer who adequately understands the breach notification steps? Is the HIPAA compliance officer receiving the ongoing training to address a breach given the constant changes within the privacy and security landscape? A couple of things to consider as we go through the different areas to cover. The simplest way of going over this is the HIPAA security protocol. It covers security rule requirements for three things: administrative, physical, and technical safeguards. Now, with HIPAA security, the protocol covers security rule requirements for administrative, physical, and technical safeguards. So I know that sounds very closely related, and it really is. Before I get into this quick chart, the audit protocol, it covers privacy rule requirements for 7 different things. Number one, notice of privacy practices for PHI. Number two, rights to request privacy protection for PHI. Three, access of individuals to PHI. Four, administrative requirements. Five, uses and disclosures of PHI. Six, amendment of PHI. And seven, accounting of disclosures. As you can see, here's just kind of a breakdown of the HIPAA violations. Physical theft has been the main one, but so is unauthorized access, which we at HCSI we call that record snooping. Now, breach notification. The protocol covers requirements for the breach notification rule. All right. Now, I know that's a little bit vague, and in the future you can ask a question more about the steps, and I'm happy to help out with those. We've found that laptops are, again, back to physical theft in the last slide. Laptops are stolen all the time. In fact, we just heard of someone that has a business associate that took home a laptop, and then someone broke into his apartment and stole the laptop. More common than that is actually just having it stolen right out of the vehicle. And then a lot of people take safety and paper records, but 21%, and this comes straight from the HHS website. So those are just a few things. Now I want to role play where you're putting yourself in the position where you're going through the audit, and I'm going to pretend to be your auditor. All right. Now, the reason you're being audited is because you've been turned in by a disgruntled patient. This patient, let's just say. So, what can you expect? Well, here is the timeline from start to finish of what you can expect. Day one, you will have a notification letter that's mailed to you. And then roughly 10 days later, there will be a request and a review for documentation. And then the auditor will be planning their field work based on the amount of documentation that they can give you, or that you can give them. Again, they'll request information, and quite often they'll come to your office and they'll look for a binder that will contain the documentation that they need. So then it can take up to from 30 to 90 days to do on-site field work. And then at that point, they draft the audit report. The certified entity reviews, or business associate reviews and comments on the draft, reports before the final draft, the final audit report is created. Now, from there, there's a fine that's extended, and in most cases, if they have to get that far, they're going to find some corrective actions, and corrective actions can take a lot longer than 90 days, and you will get a timeline of how long they expect you to correct things. Okay. Well, as your auditor, first I will be checking to see if you have implemented security measures sufficient to reduce risks and vulnerabilities to a reasonable and appropriate level to comply with Section 164.306A. Are your current security measures sufficient to reduce risks and vulnerabilities to a reasonable and appropriate level to comply with Section 164.306A? And you can find these. You can find this on hhs.org, and I can direct you to all of the sections to review that if you want to email me. Next, with the risk management program, I will obtain and review security policies and evaluate the content relative to the specified criteria. Next, I will determine if the security policy has been approved and updated on a periodic basis. I will then determine if security standards address data moved within the organization and data sent out of the organization. With business associate contracts, covered entities must enter into a contract or other arrangements with persons that meet the definition of a business associate. And it's required that a covered entity obtain satisfactory assurance from the business associate that will appropriately safeguard this information. So I'm going to inquire now of management as to whether a process exists to ensure contracts or agreements include security requirements to address confidentiality, integrity, and availability of EPHI. Next, I will obtain and review the documents of the process used to ensure contracts or arrangements include security requirements to address confidentiality, integrity, and availability of EPHI, and evaluate the content in relation to the specified criteria. I will then determine if the contracts or arrangements are reviewed to ensure applicable requirements are addressed. I will then inquire of management as to whether a process exists to identify federal, state, or local government business associates. And once again, I'll obtain and review the process used to identify federal, state, or local government business associates and evaluate the content in relation to the specified criteria. Now, notification to individuals. A covered entity shall, following the discovery of a breach of unsecured protected health information, notify each individual that has had their protected, whose unsecured protected health information has been or is reasonably believed by the covered entity to have been accessed, acquired, used, or disclosed as a result of such breach. Management, I need to know if a process exists for notifying individuals within a required time period. I need to see the key documents that outline this process for notifying individuals of breaches. And this is a very serious part of your compliance program that a lot of people just don't have in place. Here's an example of a few selected areas that I can investigate as part of my audit. Now, did you know that there's over 140 areas of compliance that can be investigated as a part of an audit? HIPAA security, HIPAA privacy, and breach notification. As an auditor, I do not accept any excuses for you not being in compliance with HIPAA regulations. Now, of course, that's what they're going to say. And if they have to dig, not a good position to be in. So hopefully everything's organized in a binder. Now, this unique set of regulations, it holds all offices accountable equally And that's regardless of the number of employees or other factors. Non-compliance really hurts practices and will result in heavy fines and permanent harm to the reputation of the business. So something that absolutely needs to be taken note of. Now, as far as ongoing proof, an auditor is going to look for established and implemented policies and procedures. And that includes policies and procedures that the employees have been trained on and proof of that training. Okay, and there are specified areas that they're going to look at to make sure it meets their requirements. Now, in addition, they're going to look at how you're incorporating the regulations into your office. And this has to do with weekly, monthly, quarterly, semi-annual, and annual. There are actual inspections that are going to be required for the compliance officer. There are regular documents. There's regular backup that needs to be done. There's a whole slew of requirements that are ongoing. Now, ask yourself, is compliance something that your office takes seriously and establishes a culture within the office in order to protect your patient's personal information? If you're audited, it's likely you're going to fit in the first tier here. Now, as far as the third tier, look with me now. Ask yourself, is compliance something that the office does with minimal effort to make it look like you're doing something? Well, you're actually putting your patient's information at risk. Ask yourself, do you fit into the fourth tier? Is compliance something that your office is irritated with and you make almost no effort to be compliant, and therefore you are putting your patient's personal information at serious risk? Well, the auditor will determine their own answer for these questions and will apply fines and penalties based on their interpretation of your office's compliance efforts. Now, this HIPAA violation penalty tiers, this comes straight from OCR. Now, here's an example of the type of policies and procedures an auditor is going to be looking for. So you have a policy. Our office uses and or discloses PHI for TPO purposes without the patient signed authorization. What's the procedure? Procedure is our office uses and or discloses PHI for TPO purposes within the patient's signed authorization in the following examples. Examples, doctor and or hospitals can share information freely with one another for treatment reasons. Next example, patient's information can also be released without their authorization to insurance companies in order to receive payment for services provided. Last example, healthcare operations can include a variety of business activities included but not limited to quality assessment, employee review, licensing, etc. So this is, and this is only an example. This is not a complete procedure. And here's another example of the type of policies and procedures an auditor is going to be looking for. So the policy, we must have a formal and documented emergency mode operation plan for protecting our information systems containing EPHI during and immediately after a crisis situation. Our workforce members must receive regular training and awareness on our emergency mode operation plan. And then, of course, the most important thing is the procedure. And this is what the compliance officer, in many cases, is required to actually develop. Procedure in this case, our emergency mode operation plan establishes procedures that will enable us to continue critical business processes for the security of our EPHI while operating in emergency mode. In the event of an emergency, we will implement this plan. And here are 4 steps that I won't read, but again, this is only an example. It's not a complete procedure. Now, there are a lot of areas of compliance that an auditor will check, but being compliant is not impossible. Regardless of the size of your business organization, regardless of how many locations or other variables, it is possible. It is possible to create a culture of compliance within your business. And this is something, this culture of compliance is something that'll help your office be HIPAA compliant and give your patients peace of mind. It really is a win-win. Again, remember Amy. Okay, if you'll recall Amy's situation, she joined a private practice as an office manager to grow her administrative resume. What she didn't plan on having to adjust for was the major blind spot of the practice, which of course was the compliance that had a lot of holes. And it wasn't until Amy went to a healthcare conference that she began asking other practice administrators, hey, how are you, how do you best develop and maintain an OSHA and HIPAA compliance program? And she was told, as many of you probably have, to go online and look at online compliance programs. Amy learned that online programs are simple to use and they're very affordable when considering, well, a consulting service, for example, as well as, after the conference, just moving on, she, in this example, typed in online compliance solutions into her Google browser. And she really got to a point where, again, wearing many hats, she realized if she didn't at least explore the option that she would likely be hitting snooze on her Outlook reminder a couple more times that year. And when browsing on one website, Amy discovered blog articles that indicated 5 ways a practice can become a target for an audit. And I can go through those. If you email me, I can share an article with you. Amy was amazed to find the HHS website requires all HIPAA breaches to be reported. Amy thought this would be helpful for the doctor to read, so she shared that and also realized a couple instances where she should have logged and reported some of the breaches that she had experienced in the short time she had been at the practice. And so, of course, Amy had read enough. She'd done enough studying. Really, this is a simple choice in many cases. And so in her case, it was time to integrate a culture of compliance. Now, you've learned today that audits are increasing. And one of the main reasons they're increasing is because of the number of breaches throughout the United States that have to do with the increase in technology. There are so many resources available. Just the other day, I went to get a health checkup, and they said, Lance, this is an app that we have that you can use to look at your healthcare history. And here's an online resource that you can access your records as well. Also, we're seeing a lot with cloud storage, the use for mobile devices to improve communication within offices. There are a lot of reasons for hackers to become increasing their awareness of how to breach these systems. And so we're finding that there's much greater need today to incorporate a culture of compliance with privacy and security, and patients expect it. Again, wherever you're at watching this video, this is your community. This is your community, and it's your families and your friends. Do everybody a favor and continue to become more stringent in updating your procedures, training on those procedures. Consider the words of a few that, other than Amy, who are incorporating a culture of compliance. This doctor said our HIPAA and OSHA compliance was a huge concern in the office, especially after one of the employees filed a complaint with OSHA. We started using HCSI 4 years ago and couldn't be happier with the program. Now, you'll notice that the employee filed a complaint with OSHA. A lot of times it's the patient. Sometimes it's even the business associate. One more HIPAA success. HCSI kept my fanny out of the who's cow with a cranky. I guess that means weirdo or psycho. And again, this is directly quoted. Patient who thought that we had been naughty in multiple ways. Our association with you made all the difference. And whoever you're associated with, hopefully there have been some insights that have come in this presentation. And certainly there are several articles that we have on our blog, which is hcsiinc.blogspot.com. We suggest that you actually just go to our website, which is just hcsiinc.com, and there's an orange button that you'll see on the left-hand side of the screen. It's among 4 different buttons that will take you to our blog, and you can read a lot of additional resources. Well, there's a lot more information that we could share with you. We realize your time is valuable. We really wanted to just give you the meat and potatoes of what you can expect. Again, here's my information. Feel free to follow us on LinkedIn. If you connect with me, Lance King, I can send you some resources. In fact, we have a private, if you're not already a part of this, a private LinkedIn group for practice administration. And we post a lot of the latest updates and have a lot of discussions about what is happening with things like this OCR update. And we talk about things like, why is OCR increasing their budget right now? And doing these random audits. And are these audits going to be just a desk audit? Are they going to be actually coming to the practice? How are they getting the business associates? Are they going to be business associates that we're using? These are the types of discussions that we have. We just want to be a valuable resource in helping you, again, incorporate a culture of compliance. I think I've exhausted that, but we sure appreciate you making time to visit with us. And this is a webinar from Healthcare Compliance Solutions. My name is Lance King, and I hope you make it a great day.